Hi, I'm Dr. Jerad Gardner, and today in this video we're going to talk about the similarities and the differences between coronavirus, SARS-CoV-2, which is the novel coronavirus that causes the disease known as COVID-19. We're going to talk about the differences between COVID-19 and the seasonal flu, the influenza virus. I made a video last week talking about why I was concerned about COVID-19 and why I feel it's a serious threat as a physician. And if you want to check out that video, it's aimed at non-medical people. It was basically to answer questions that a lot of my friends and family were asking me. I'll put a link down in the video description below, and you can check that out if you haven't seen it yet. Today is March 18th, 2020, and what I'm going to tell you today is my own personal views and opinions based on all of the things that I've read and looked at using my medical judgment and analytic skills to sort things out and summarize them in a way that hopefully is understandable to all of you. And again, for friends and family, I wanted to be able to answer all of these questions that people were asking me. Of course, this is not medical advice. I'm not your doctor and you're not my patient, so I can't tell you what's right for you. If you have questions about your medical care, of course, ask your own doctor. And also, I'll put links to some references and resources down in the video description. And if you can hear what I have to say and what I think about all of this, and then you can go read those things and check other sources and decide for yourself what you believe. I'm not telling you what you have to believe or have to do. I'm just telling you that as a physician who's spent time looking at this and reading about it, this is what I think and what I feel and believe is true based on what I know as of today. Obviously, this is a unprecedented situation in my lifetime, at least, and the situation's evolving rapidly and changing. So things may be very different. If you're watching this video, even a few days or a week from now, things may be different. So as of this morning, when I checked on the Johns Hopkins COVID-19 case tracker website, which is a great website, I'll link to it in the video description, there were over 200,000 cases now globally of coronavirus infection with COVID-19 disease. And so far, over 8,000 people have died from COVID-19. So this is all, of course, starting at the very end of December 2019. So we're, not even quite 3 months, not even 3 months yet since this first came up. So one of the things that I've heard a lot of people say is, well, yes, people are dying and yes, people are sick, but flu causes that too. And we have flu every year and a lot of people get sick and die from it. So coronavirus is just basically like flu, right? And I've heard that comment from a lot of people. Well, there are some similarities between the novel coronavirus and influenza. For one thing, they're both viruses that infect mainly the lungs and cause respiratory disease. And the common symptoms that they both share are cough and fever. In most cases, you'll have cough and fever, both for flu and for COVID-19. So that can make it a little difficult sometimes to sort out whether someone has flu or whether they have COVID-19. They are both spread in a similar way. They're spread by droplets from coughing or sneezing, so mucus droplets that come out of the mouth or nose that have virus particles in them, and then either are inhaled by someone standing close to you, which is part of why people are recommending that we stay at least 6 feet apart from each other, in the hopes that any droplets like that will settle down to the ground and not get inhaled. And then the other way, though, is if the droplets land on a hard surface or on any sort of surface, and then you touch that surface, and then you rub your eye, nose, mouth, and the virus then enters into your body through that route. So that works for spreading both flu and the coronavirus. Both of them spread in a similar way. So those are the similarities. But after that, there are some differences. For one thing, they are both viruses, but they are totally unrelated different viruses, okay? They're in different families. Coronavirus obviously is the family of viruses that the SARS-CoV-2, that's the technical name for this virus that causes COVID-19. There are other coronaviruses. In fact, a few of them are really common and are part of what caused the common cold. But this new SARS-CoV-2 virus is totally different and much different in the way it causes disease than those common coronaviruses that cause cold. So it's really important to distinguish that they're not the same thing at all, even though they're related genetically and in the same family. The flu virus, influenza, is in a totally different family. It's in the orthomyxoviridae, orthomyxovirus family. So it's a virus, but it's different and distinct from the coronavirus family. Okay, flu and coronavirus, I said, both cause cough and fever most of the time, but flu has a few other symptoms: muscle aches, headaches, chills. Those are pretty common in influenza, but not as common in COVID-19. Possible, but not very common. The other thing is that flu has a relatively rapid onset, a short incubation time. Incubation time is the time between when you get the virus into your body and when it actually starts causing symptoms. In flu, usually that's within 2 to 3 days. About 3 days after you get the virus into you, you start feeling pretty sick. And so it's a relatively rapid onset. And coronavirus tends to be later than that. The average time from what I've read so far is about 5 days after getting contact with the virus before you start having symptoms. And the other thing that I've read from several sources is that a lot of patients with COVID-19, even once they start having symptoms, they may have a cough, they may have some fever, but they don't get really sick all of a sudden. At least some people don't. Some people start out kind of just with a cough, they push through it, they're okay, and then they start going downhill and eventually end up having breathing problems and going to the hospital. So they may have had symptoms for some time, days or even a week, before they actually seek medical care. And so that longer disease course is unusual for the flu. The flu, usually within a few days you have symptoms, and most people tend to get better, if the ones that recover, tend to get better within about a week or so. Whereas I've heard of coronavirus patients, particularly the ones, the COVID-19 patients with severe disease, sometimes take several weeks or up to a month before they can get to the point where they can get out of the hospital and start feeling better again. So a very long, progressive, kind of delayed disease course for COVID-19 compared to flu, at least in a lot of cases. So those are some differences between the symptoms that the two viruses cause. All right, let's talk about severity. I think this is the thing that people talk about the most is coronavirus more likely to kill you or make you sick than influenza? And the answer is we don't know for sure yet, right? So now you're gonna think this video is just clickbait, but I'm gonna tell you some statistics and data from what we do know. And again, you can sort through that and decide what you believe makes sense for yourself. Several people on my last video commented, well, why don't we everyone's panicking and freaked out about coronavirus, the flu kills all these people, why don't we take that seriously? We do take the flu seriously. It does cause numerous people to get sick and hospitalized every year, and many people die from influenza every year. So it's actually something we take very seriously. You probably all know this about, every year people are saying you have to get your flu vaccines, and we make a big deal to push for that. In fact, in my job as a physician, there's a certain point in the year that if I'm not flu vaccinated by, I can't come into the hospital. I'm not allowed to come to work if I haven't had my flu vaccine. And that's a common thing, at least in the United States. Many healthcare organizations have that same rule to hopefully avoid physicians or other healthcare workers from bringing flu and transmitting it to the patients and making them even sicker. So we actually take flu very seriously. The thing is, flu has been around for a long time. We don't have a way to totally fix and prevent it, but we recognize that it's an important problem, and we recommend people do a lot of things to minimize the risk of getting very sick from influenza. Okay, so what is the mortality rate for seasonal flu in general? On average, from most of the statistics that you'll read, flu kills about 1 per 1,000 people. So for every 1,000 people that get influenza, approximately 1 person will die. Now that does fluctuate depending on the age of the patients, the pre-existing conditions, a lot of different things, but that's kind of an overall general average is about 0.1% fatality or mortality rate. So 1 in 1,000 people will die on average with flu. There are years where we have more severe flu and pandemic flu that happens every once in a while, and those can be more severe and cause more people to die. And we'll talk a bit more about that in a few minutes. So the looking at just this year, for example, I looked up on the Center for Disease Control, the CDC website. They said that in the 2019 to 2020 flu season in the United States, there were approximately 22,000 to 55,000 deaths from flu. So that's a lot, way more. I just said earlier, there have only been, or I don't know if only is the right word, there have been 8,000 deaths from coronavirus since this pandemic started. But I just said that just in the United States, 20 to 50,000 something deaths from flu. So this is why people see these kinds of numbers and say, why is everyone freaking out about coronavirus? Because clearly flu kills lots of people. And again, it is true. It does kill lots of people. So the mortality, though, is about 1 in 1,000. So what about coronavirus? The SARS-CoV-2, the virus that causes COVID-19, we still don't know exactly what the mortality will be because it's only been around for a couple months and we don't have complete data about it yet. And if you go to one of the sites that reports the statistics, like the Johns Hopkins site that shows how many cases are confirmed and how many people have died, you can make some calculations from that. But like many other people have pointed out, if you do that, the numbers look very grim, and that almost certainly is an overestimation. The mortality rate is probably less than that. It's just there are probably many people out there in the population who have coronavirus, and we just don't know it yet because either we don't have access to test or they don't feel very sick and they don't come for testing. So the way, in a perfect world, what we would be able to do is we would test every single person in the world, and then we would follow them until, a month or so from now and see who lived and who died, and then we could calculate the rate of mortality. But that's impossible to do. There's no feasible way to do that. So down the road, after this has gone on and is hopefully resolved one day, hopefully in the not too distant future, epidemiologists will be able to look back and figure out more precisely what the mortality rate is for COVID-19. So if you look though on the tracking site, the range that you get is pretty broad. If you look overall, 8,000 deaths out of 200,000 known cases, that gives a mortality of about 4%. And again, that is probably way higher than it actually will be in the end. And the mortality varies from country to country, probably for a variety of reasons. If you look at Italy, the mortality is right around 8% currently, whereas if you look at South Korea, the mortality is just a touch below 1%. So why are those differences? Again, the difference probably has a lot to do with how many people are getting tested in the general population for that country. South Korea, for example, has tested, I think, well over 200,000 people, the last statistic I saw. So they have a pretty good idea of how many people in their country actually have the virus. It still may not be perfect numbers, but they know a lot more probably than a lot of other countries because they've tested very aggressively to see just how many people have the virus. And so that's why some experts think that the final mortality rate, once we get a better idea, will probably be somewhere around 1% or maybe even below that, depending on which expert you read. And that idea is that probably South Korea's numbers are probably closer to what the actual mortality is than some of the other countries where we don't have as complete of data. So in any case, though, the official statement, though, is that we still don't know for sure. So all of this is based on our very limited data now and will likely change. But if you believe those experts who suspect that the rate of mortality is 1%, 1% doesn't sound too bad. If you have the disease, it means, well, you have a 1% chance of dying, but a 99% chance of living. Overall, again, it will vary a lot based on how old you are and what underlying medical conditions you might have. That seems to play some role in people that have a worse course or a better disease course. But in any case, you might think that 1% is not too bad. But if you compare it to the death rate from flu, which we said was 1 in 1,000, 1% is 1 in 100. So that would be 10 times more likely to kill a patient than influenza. 10 times a higher death rate is quite a bit different than influenza, I think. So again, it really depends on, and see, I'm touching my face. It's hard not to do it, but I'm trying my best to avoid it. It depends on, again, what the final mortality comes up to. But if you believe those experts that say it'll be about 1%, and we know that influenza on average is 0.1%, 0.1% or 1 in 1,000, then that means that COVID would be 10 times more likely to be fatal than influenza. That's a pretty big difference, I would say. The other thing is that when we look at COVID cases that are really severe and that end up causing patients to be put in the hospital in intensive care and intubated, and the cases that ended up causing death for patients, the way that patients usually die from COVID is that they get something called acute respiratory distress syndrome, or ARDS. So ARDS is basically when the little air sacs in the lung called alveoli, the walls of those get damaged and thickened, and it doesn't let oxygen pass easily from the air into the bloodstream. And because of that, patients end up getting shortness of breath, low oxygen levels, and that can eventually lead people to die. It's a very serious pattern of damage to the lungs that is often requires very advanced supportive care and can easily be fatal. So other things, influenza can cause ARDS, and a variety of other diseases can too. So it's a type of lung damage that can be caused by different things. My friend and colleague, Dr. Sanjay Mukhopadhyay, who is a world famous lung pathology expert, he just made a really great video yesterday that's all about ARDS and how that's seen on x-rays and also under the microscope. And he really goes through and shows you exactly what lungs with ARDS look like and why this is causing such a problem for patients with COVID-19 and other diseases that cause ARDS. So I'll put that link down below in the video description, and I highly encourage you to check that out. It's sciencey and will show you technical details, but explained in a very easy to understand format, with the goal that non-medical people can appreciate it and learn from it as well as medical people. So the thing is that mortality between COVID-19 and influenza is still debatable, right? There are some people who don't believe the 1% statistic and say the mortality, once we calculate all the people that have mild disease that have not been tested, once we do all that, it'll just be just like influenza. Okay, that's a fair point. If you believe that, we can talk about what it would be like if that's true. The thing is that fatalities are important, obviously, especially to the people who die and to their loved ones. But there are also a lot of people that will get sick and not die, but they will need hospitalization. And that's the serious concern I think that I have and that a lot of other medical people have, is not just the mortality rate, but the fact that there are so many people likely to get sick to the point that they need hospitalization. And we are concerned that there will be an overwhelming of the medical system around the world, every hospital potentially overflowing with patients who need care, and we may not have enough resources, enough rooms, enough ventilators, whatever it may be, to take care of those people. And that's a really scary and terrifying prospect for us in the medical world, because we always want to be able to take care of our patients. So the question then comes up is COVID more likely to put you in the hospital than influenza? If you look, the average the approximate hospitalization rate for influenza is around 1 to 2%. So if you get influenza, about 1 to 2% of patients with influenza will need to be hospitalized, okay? So far, if you look at the numbers we know now for COVID-19, about 20% of COVID patients need to be hospitalized. 15% will need general hospital care, and 5% will actually need advanced care, intensive care unit care, and potentially ventilators and breathing apparatus to help them breathe. So again, that number of 20% needing hospitalization is probably higher than in reality, because again, we don't know about how many people out there have mild disease that have the disease and are not even being detected and tracked. So that's another question. But again, the concern we have is that if there is a higher risk of getting hospitalized and a bunch of people get the coronavirus around the world, that could easily overwhelm our healthcare system. Okay, let's talk about treatment for these two diseases, the flu versus COVID, and also immunity. There are some big differences here. Number one, for flu, we have several things that help us deal with influenza. We have vaccines. We make a new vaccine every year because the flu mutates and changes over time. And even though the vaccine is not perfect, some vaccines are very good and are highly effective at preventing people from getting a certain disease. The influenza vaccine is not perfect. You can get the vaccine and still end up catching the flu sometimes, but it does reduce your chances of catching flu. And also, if you do catch flu, it reduces how severe that it is much of the time. So having vaccinations for the majority of people in a population certainly reduces the risk of severe illness or death from influenza. And the other thing is we actually have an antiviral drug that can be given to people. If it's given soon enough after they are diagnosed with influenza, it can potentially reduce the severity of the disease. Again, it doesn't cure it, but it can make it not as severe. And finally, influenza, like I said, it mutates and changes over time, year by year. And every once in a while, the human influenza virus will recombine and mix up with the influenza virus from an animal, like from pigs or from birds, and that's where we get the swine flu or the avian flu. And those types of flu tend to have a lot of differences from the old type of flu, and they are a lot more potentially aggressive and can be much more problematic. And those are the times when we have pandemic flus, because our immune systems are not able to recognize those. But most of the time, from year to year, the virus changes, but parts of the virus are similar to old types of influenza that have been around in the previous years. So what that means is that sometimes our body may already have some degree, maybe not perfect immunity, but some degree of immunity against the current year's flu virus, because it has some similarities to a previous year's flu virus, and our immune system recognizes some of those parts of the virus and can give us some degree of immunity. So all of those things kind of help us to deal with influenza, which is a seasonal thing we deal with in the winter of each year. COVID-19, the SARS-CoV-2 coronavirus, we don't have any of that. We don't have any vaccine yet. We are, obviously people are aggressively working on that, but unfortunately, from all of the predictions that I've heard, if we are able to get a successful vaccine, it will be at least a year to a year and a half from now, is what most experts think. This is not something that's going to be a fix that comes really quickly, which is really unfortunate. But there are people working on it, but it takes a long time to get a vaccine up and running for widespread use. I read that there have actually been some preliminary, or like just recently, I think there was a preliminary test of one of the vaccines that's being formulated. But to get it to a point where it's proven to work and be safe and to have it available for widespread use is going to take a much longer time. The other thing is we don't yet have officially approved drugs, although there are some studies and some papers that have already been published. I've read about chloroquine and hydroxychloroquine that some people have talked about using potentially, and a variety of other things. I think that's going to have to get looked at and hammered out to decide if it really works or not. In my job as a pathologist, I diagnose diseases, but I don't treat them. And so I'm not an expert on drugs or medications. I learned about it in med school, but I haven't really practiced that kind of medicine for a long time. So in any case, but I have read that there are people looking at it, but still from the WHO website and CDC website, there's not any official drug that can be given that's been approved for use to treat this coronavirus. And again, because it's a totally new virus that just transferred into humans, probably from an animal host just a few months ago, no one in the world has immunity to it. Even though we get coronaviruses with the common cold, this coronavirus is totally different and no one has any immunity. So all of that, the lack of immunity because it's a new virus, the lack of a vaccine, and the lack of a proven drug makes this a much more worrisome situation, because we don't have anything to help protect us against this new virus, whereas we have some things that can help protect us against influenza. So you may say, well, okay, it might be serious for some people, but looking at the statistics, 80% of people, from what we know so far, and maybe even more, are likely to have mild disease or even no symptoms at all potentially from coronavirus. So you may say, well, statistically, you know what? It's unfortunate that other people are going to get sick and maybe die, but I'm going to be okay, right? You might look at things and say that. But again, the worry that we have is that there are going to be so many people sick that it could overwhelm the medical system. And, what if you have appendicitis? What if you get in a car wreck, or your kid falls off their bike and breaks their arm, or you have a stroke or a heart attack, or any number of medical things? If all of the hospitals are completely overwhelmed and being crushed by the weight of so many very sick patients from coronavirus, that's going to be problematic for getting care for anything. It's going to cause all sorts of problems for access to medical care, not just for coronavirus, but for everything. That's the concern that we have in medicine. And you hear people say, well, that's just fear mongering, and that's just hyped up stuff from the media. You know what? I am not getting paid anything to make this video. My YouTube channel is not monetized. I don't have ads on it. I'm not working for any news agency. I don't have to sell advertisement space or anything like that. I'm just taking time out of my day to try to educate and help other people, because that's what I feel is the right thing to do. And I'm giving you the most honest answer that I can based on what I know as of today, from what I've read and studied and heard from other experts and learned about. I don't have any political agenda. I don't have any reason to do anything except hopefully try to do what I can to make our society safer and make it so that fewer people suffer and that fewer people die from this current pandemic virus. That's my goal. So I think that's a really important thing to keep in mind, though, that we really have to keep the medical system from being overwhelmed. So the other thing is that, let's say for the sake of argument that you believe that coronavirus is no more fatal, no more aggressive than regular influenza. So I don't believe that. I believe it probably is more aggressive. But if, let's say you're right, and that it is just the same mortality rate and no more likely to make you sick, you have to remember that we still have influenza, though, right now. Coronavirus doesn't replace flu. We still have flu sickness all the time. We have people right now that need hospitalization, not for coronavirus, but for influenza. So the coronavirus patients, even if it's only at the same rate as flu, is going to be on top of all the flu patients we already have. So at the minimum, it would be like doubling the number of patients we have sick and needing hospitalization from regular influenza, okay? And that's assuming that it will only impact as much of the population as flu does. So if you look at flu, it changes from year to year, but approximately, looking at the 2019-2020 flu season based on the CDC data, about 15% of the population is going to be infected with influenza, to get flu this season, the 2019-2020 season. So 15% of the population of the US approximately will contract flu over this year. What about coronavirus? How much of the population is likely to get that if we don't have any immunity and no vaccines? And if we're not doing enough to keep it from spreading? Some people think that it's more contagious than flu. Not everyone agrees, but I feel like more of the things I've read have favored that this is probably more infectious, more easily transmitted than influenza is. But even if it's not, the fact that no one has any immunity to it is pretty concerning, I think. And some experts have predicted that it could be 40, 50, 60% of the population of the whole world could potentially get this. And if that all happens in a short period of time, even if the hospitalization rate is only 1 to 2% and the death rate is only 0.1%, that is still an awful lot of sick people and an awful lot of people dying. Way, way more than we'll have just from a regular seasonal flu. So you may think it's not your problem, but it will be your problem if it collapses the healthcare system and you or someone you love needs to be taken care of. And I think it's really important, and I'm not just saying that because I'm in the healthcare system, and obviously I care for my position and all of my colleagues and what we have to do on the front lines to help take care of sick people. But I want to make sure that everyone has access to medical care and that the medical system stays intact so that we can provide that, so we can take care of everyone who's sick. So that's why we really need to take this seriously now. I know it may not, when you look out your window, you don't see people dying on the streets or anything like that. But if you look at other countries that have had the COVID-19 come there before it came to the United States, they're like a week or two in the future ahead of us. So where they are is where we may be in a week or two if we don't take this really seriously. That's why we're closing schools and telling people to not go to large gatherings and to stay 6 feet away from each other and to, do the spot greeting or the namaste or the thump your chest instead of high fives or handshakes, to avoid spread, to minimize how many people get this, and at least to flatten the curve and slow down the spread of the virus, so that we don't have too many people sick at the same time. That's the goal, at least. Because until we have something else to offer, that's about all we can do, is staying away from close contact, stay home whenever you can, wash your hands aggressively, and if you get sick, quarantine yourself and stay away from everyone else as much as absolutely possible. That's the best that we can kind of do to try to reduce how severe the impact is going to be. I personally suspect it's still going to be pretty bad, and that we're going to have a lot of people sick, and it's going to be a really difficult time in the coming months and potentially longer. I don't like that. I don't want that to be true. I would love that in a few weeks, everyone can come back and post comments on this video and say, see, you were so stupid and this was all hyped up. That would be the best thing in the world, to be wrong and to have everyone be okay. That would be so much better for me. And I know it's hard to believe stuff that we don't want to be true, and things that are scary and that cause us to feel fear. I think that we have to take it seriously, though, and we have to take aggressive action now. And if you read some of the comments from people in Italy or in Spain, in other countries that say, hey, we were laughing and joking about this and thought it was no big deal when we only had, a few hundred cases, and then everything exploded and now the hospitals are overwhelmed. And if you look at Italy, they are undergoing heroic efforts to expand their ICU beds and make their hospitals stay open and try to provide care for everyone, but they are struggling and they are overwhelmed. From every account that I read, they are having a lot of difficulties dealing with that. And even though they are doing everything possible to try to take care of all these sick people, and to me, that, putting all the numbers aside, that tells me that this is potentially a lot more severe than influenza, because you don't hear about those kind of problems happening every winter in Italy or in other countries from the seasonal flu. There are years where it's more difficult, but we have that built into the system. We know there are going to be a certain number of flu cases on average every year, and we have our system built to try to accommodate flu season. But this is adding a whole extra burden on top of all of that. And that's the real concern. So we have to take it seriously. And if we wait until things look really bad here, and we just keep going out to, to parties and bars and big events and spreading the virus around before any of us realize that we're very sick, then we're not going to realize that we need to do something until it's way too late. And things are going to have to get very severe before they start getting better. And I'll leave you with a couple quotes. One is from Michael Levitt, former Secretary of the U.S. Department of Health and Human Services. And he said in the past, everything we do before a pandemic will seem alarmist. Everything we do after a pandemic will seem inadequate. Ahead of time, it's going to seem crazy and overreactive. And after we realize, oh, wow, this is really bad, then we'll all wonder, well, why didn't we do more sooner? And so I think that's such a poignant way to think of it. And a viewer on my previous YouTube video, his name's Brandon. I don't know his last name or anything else, but he left a quote, and I Googled this to see if this was someone else's quote, but I couldn't find it on Google. So if you know the origin of this quote, please let me know in the comments. Otherwise, I'll assume that it's from Brandon. But he said, a successfully halted pandemic is indistinguishable from an overreaction. And I thought that was a perfect, succinct way to say it. I have to be honest with you, I'm not sure if we can totally halt the spread of this disease given how widespread it is. I'm not sure. Gosh, I hope so. But I don't know if it's possible, but I think that the goal at this point is to do everything we can to reduce the spread of it and slow it down so that the system has time to take care of the patients as they get sick and hopefully get them through it and get them better. And also, so hopefully we can figure out drugs to treat this and continue to work towards a vaccine in the future. I know it's a scary time. It's a time unlike any that I've experienced in my medical training or practice. And I think that we can all make it through this, but it is going to be serious, and it's going to take a lot of us making sacrifices and working together as a team across the whole world to make sure that we do everything possible to reduce the number of deaths. And the way I explained it the other day to my medical students is, it's one thing to talk about percentages and death rates and hospitalization rates, but when you realize that these are not just numbers, these are actual real human lives. There's someone's brother or mother or aunt or uncle or grandparent that is even if they live, that is suffering immensely to have to be in an ICU for a couple of weeks on a ventilator. That's a terrible thing to have to go through for anyone. And to think that even a single person less that doesn't have to suffer, if me not going out to a pub or to a restaurant can help make sure that one other person doesn't suffer or die from this disease, then that's a sacrifice I'd be happy to make. So when we think about it in terms of individual human lives and not the numbers, I think that really, to me at least, helps me to remember this is why we do it. This is how I deal with my medical practice, is remembering that every specimen I look at, every diagnosis I make, it's not just a number, it's a real human life. And that gives me a lot of perspective and helps me keep going when I feel sometimes like it's hopeless and like things are too difficult. So I don't know if that helps any of you, but I hope that it helps you to think about the similarities and differences between influenza, the seasonal flu, and the SARS-CoV-2 coronavirus, COVID-19. And then you can read the links in the video description and go reference other sources, and you can decide for yourself what you think. But I would urge all of you, please take this seriously, because if we're wrong and we overreacted and we washed our hands too much and we missed out on some fun times that we could have had at parties or things like that, well, that's a pretty small price to pay probably. I would rather overreact now than underreact and realize that we really made a big mistake. So until next time, if you want more videos like this, please let me know, and let me know in the comments what things you want me to cover. But until next time, stay safe, stay home, and wash your hands.